I'm Dr. Taras John Odulak, and today we're going to go over the 5 hidden drivers of chronic knee pain. Hi, and welcome to the knee webinar. Let's get started with some facts. 1 out of every 4 people suffers with knee pain. That's about 65 million people in the United States alone. The cost of knee replacement surgery can be upwards of $100,000. The bad news is 30% of the people who have had surgeries are not happy with the results. They're dissatisfied. They're not doing well. But the good news is when treated early enough, surgery may actually be avoided. Before we get started today, let's go over the agenda, what we're going to talk about today. Number one, I'm going to go over my story, why I treat knee pain and my struggles with knee pain, and how I finally got through it. We're going to talk about why most knee treatments eventually plateau, meaning people just don't get better. They try the same things, but they don't improve. We'll talk about some of the causes of knee pain. Number one is a compressed knee, one that's pushed down and feels stiff. You can't move. Number two, persistent inflammation. Knee's always tender. It always hurts. It throbs. It's worse at night, worse when you go up and down stairs. We'll talk about instability, that feeling that you get when you're walking and the knee feels like it's just going to pop right out. We'll talk about poor circulation, and we'll talk about why actually the healing process isn't working. We'll also talk about why most treatment plans miss the mark. They don't really address what needs to be done to get the knee to heal. And finally, we'll talk about who this actually matters for. Let me share with you why this is personal for me. I've been practicing for 36 years and I've had a very active career. I have a busy family life. I have 2 amazing daughters and a wonderful wife. And during my free time, I spend it playing hockey. And I began experiencing the same degenerative knee pain a lot of my patients were having and complaining about. On the outside, it looked fine, but stairs, long days, and the subway platforms told a different story. Not moving freely started to affect how I felt at work, in my personal life, and in my sporting life. This led me to dig deeper and develop a more structured approach to knee recovery. That's when I developed my 5-step knee renew and pain reduction program. So before I go over what happens when a knee is actually in pain, unstable, and degenerating, I want to go over why most treatment plans plateau and actually don't really work. Number one, ice and rest. So people use ice and rest when the knee really hurts and they just have to sit down and put a cold pack on it to drop the pain. And that's a good thing. That gives you relief, but it's temporary. You're not getting to the reason of why that knee swells up on you. Number two, cortisone injections. Well, cortisone injections are like a miracle. The problem is they only last 2 to 4 to maybe 6 weeks because they don't get to the problem. All they do is kill the pain. Another thing that cortisone brings us is it causes damage to the bones and causes the knee actually to wear and tear even faster. Let's talk about physical therapy and muscle strengthening. Well, those are really good as well. It's important to strengthen the muscles above and below the knee. But if the knee joint is not addressed, you have strong muscles and you have a weak and damaged knee joint. Surgery, minor surgeries will usually snip out little parts that are causing problems when people are in pain, but they don't address why the pain is happening or why the knee is breaking down. So eventually, minor surgeries run into a total knee replacement surgery. Most of the patients that I see that come in with very bad knee pain or moderate to severe knee pain, well, they give me a history that the knee was first swelling and it would grind once in a while, and they had some pain here and there, but it wasn't really that bad. But over the months and over the years, the pain progressed and they got to the point where things are grinding, popping, clicking, and some of them can't even move the knee anymore. Let's get into why knees hurt, and let's get into why knees actually get worse when unaddressed. Okay, so let's get into the 5 hidden components of why knees become painful and become degenerated and sometimes lead to total knee replacement. Number one, compression. So the knee joint has two long bones, a kneecap, and soft tissue between the two long bones. Now, when that tissue starts to get compressed, what most people tell me is it feels tender and painful on the inside of the knee, and I start to hear grinding and popping. It becomes painful, and the cartilage and bone begin to wear down. The second most common complaint that I hear from people is persistent inflammation. The knee swells, it becomes stiff, it becomes painful. The typical person will say, when I wake up in the morning, it's stiff. I start to walk a bit. It feels better. It loosens up. I think I'm going to have a good day. And by the end of the day, the pain and inflammation has gone straight up through the roof. Another common complaint that I hear from people is, hey, doc, when I'm walking down the street, I feel like my knee's going to collapse, like it's going to pop right out of the joint. It especially hurts when I go up and down stairs, and I feel unstable, and I'm really worried that things are going to just pop right out. Now, this is a component of knee pain or why knees get damaged that I don't hear people complaining about. It's poor circulation and nutrient delivery. When the knee gets compressed and when it swells, we're not getting good blood flow in and out of the hard, bony surfaces and the soft tissue in between the two bones. Now, every part of our body, every cell of our body needs blood flow to be healthy. So when the knee starts to lose normal blood flow, tissue literally begins to die off without the oxygen. The failed healing process. If you add up all of the components that we just went through, compression, ligament laxity, poor circulation, inflammation, all of those together cause the knee to not be able to heal on its own. You know that if you cut your skin, your body usually heals it. You know, if you break your bone, the body heals it up. When a knee is compressed, when it doesn't have circulation, when it's unstable, when it's inflamed, it can't go through the healing process. So what's the solution if you're suffering with knee pain? Well, I've developed a 5-step knee renew and pain reduction program that covers all the components that are happening when knees don't heal properly. Knee decompression stretches that knee open. Laser therapy reduces pain and inflammation. It increases circulation into the joint. We do a knee alignment if needed, meaning we check the arches and the hips and make sure the knee is in the proper position so that when you're walking, it's not grinding. We have a stretch program that helps stretch all the muscles around the knee. And in many cases, we'll do stem cell or platelet-rich plasma injection. And that's to kick off the body's own ability to heal that knee as normal as possible. Well, who this matters for? This is for the people who've been told, hey, it's just arthritis. There's nothing you can do about it. Take some painkillers, try some cortisone, rest when you get home, put some ice on it, try to live with it. It's for people who want to avoid surgery. Maybe even most importantly, it's for people who want to stay active, who want to be able to walk up and down stairs without a problem. They want to bike ride. They want to go to the gym. They want to be able to play with their kids or their grandkids. This is for people who don't want to just mask the pain. We make the right diagnosis. We do the right treatments for those we can help, and we get the right results. So I want to thank you for attending this seminar on the 5 hidden drivers of chronic knee pain and why you may not be getting the results and relief you may. If you're ready to take the next step forward, you're welcome to schedule a knee renew discovery visit with us. We'll do a good consultation and examination. We'll tell you if we think we can help you, and we'll tell you if we think we can't. If this is something you'd like to look into further, I welcome you to a discovery visit at our office. Here's what you'll receive: We'll do targeted testing to identify the true source of your pain. We'll do a comprehensive knee examination. We'll do a focused evaluation on your posture, how it's affecting the knee. We'll put your knee through ranges of motion to see where the grinding, popping, or swelling is. We'll do pain mapping. Pain mapping helps us target to find out exactly which area is wearing out and giving you pain. And then we'll take digital x-rays so we can actually see the joint and see what stage of wear and tear you have and make a decision if this is actually something we can help you with. If you have previous MRIs or x-rays, please do bring them. It'll help us see where you were. It'll help us see potentially where you're going and how we can serve you best.